be useful to think of the AIMS examination as having two parts, one informal and the other structured. The AIMS examination is scored by observing and rating the severity of the abnormal involuntary movements in 7 different body areas. A scale of 0 to 4 is used. 0 is used when no movements are present. 1 indicates minimal involvement and should also be used for movements which may, in fact, be extreme normal. 2 is for mild movement. When the informal observations have been completed, the structured portion of the examination can start. Since standing over a patient may make him uncomfortable, it's best to sit next to the person. This allows the examiner to easily demonstrate the required movements. This is an appropriate time to discuss the purpose of the examination. Your description should be brief and to the point. Excess explanation may only serve to increase anxiety and confuse some individuals. The first step of the AIMS examination requires the examiner to ask the patient whether there is anything in their mouth, such as candy or gum. If there is, it must be removed. Second, ask the patient about the current condition of their teeth. For example, does the patient wear dentures? Do teeth or dentures bother the patient now? Patients with tooth or gum disease may develop oral movements which mimic those of tardive dyskinesia. Dental status becomes important when trying to make a differential diagnosis. Instruction 8 of the AIMS examination has the patient tap their thumb with each finger as rapidly as possible for 10 to 15 seconds. Do one hand at a time. The primary purpose of this exercise is to distract the patient. Due to the concentration required to perform the exercise, previously suppressed movements will frequently appear. The examiner should not be concerned with how well the finger tapping is performed, but instead should look for any facial or leg movements precipitated by this exercise. Do not score mirror image movements of the opposite hand. Please note, item 8 is often referred to as one of the activated movements. Some examiners score this portion differently. This scoring variation will be discussed in a few minutes. Mentally score each segment as you view it. Near the end of each piece, the correct score will appear in the lower right corner of the screen. This is the score of a practitioner panel. The segment number appears in the upper left corner. Remember, abnormal involuntary movements are scored from 0 to 4. 0 denotes the absence of any movements. 1 is minimal. It may be useful to think of 1 as extreme normal, movements which are borderline. 2 is mild. These are movements which are decidedly not extreme normal. The person obviously has some degree of abnormal involuntary movements. 3 is moderate, and 4 is severe. This segment features a rather subtle lip movement. Notice the sucking in the lower lip. You may think this movement is minimal and give a score of 1. This would be too low. Remember, 1 is used for borderline movements, movement which may actually be extreme normal. This movement is too persistent to be extreme normal and should be scored 2. The patient in segment 10 has constant jaw movement. Notice the frequency and amplitude of the movement does not change. It is the same before, during, and after the activating exercise of extending the arms. This is a good example of why a point should not be subtracted when scoring movements detected during an activating exercise. Segment 11 is quite short and will be shown 3 times. Notice the increased frequency and amplitude of this woman's jaw movements compared to the previous segment. The fourth body area to be scored on the AIMS examination pertains to the tongue. Pay particular attention to whether the tongue breaks the imaginary vertical plane connecting the upper and lower teeth. This automatically warrants a score of 3. Segment 12 shows a borderline tongue movement. When this man opens his mouth the second time, there is a quick jerk of his tongue. That portion is shown twice. Without further observation, it would be difficult to justify more than the minimal score of 1. The jerky movement observed may only be extreme normal. This segment illustrates a mild movement disorder. Sufficient movement is observed to rule out extreme normal. This woman is attempting to stick out her tongue. It is not uncommon for patients to have difficulty with this maneuver. A mild movement disorder is obviously present.